So my best friend is here. She was here to get her fibroid operated last month. I have actually seen what came out post the surgery. It was really scary. And since then, we have been talking a lot about what if it comes back. So, wanted to ask you a few questions about fibroids, starting with what are fibroids really?
Fibroids are really benign, which is non-cancerous tumors of the wall of the uterus. They can be present on the outside wall of the uterus, inside the muscle layer of the uterus, and also inside the cavity of the uterus. Essentially, benign uterine tumors.
Okay. And what are the symptoms? Can some women also not have symptoms?
Yes, it's not uncommon at all to find women with fibroids and they're walking around without even knowing about them. But the common symptoms of fibroid for which people seek help are heavy periods and pain during periods and at other times as well. So, cyclical as well as non cyclical pain. Sometimes in pregnancy, they can also predisposed to miscarriages or premature labor if they're very big or situated inside the wall of the uterus, and occasionally can cause infertility too.
Okay. And am I wrong to think that surgery is the only way out for fibroids? If yes, what kind of surgery? Because now we have advancements, we have robotic surgery and such things.
Surgery is one of the ways of dealing with fibroids. There are lots of other ways as well. Medical therapy is possible, and that's aimed towards keeping the fibroids from causing problems. So the bleeding would stop and the volume of the fibroid would shrink a little, but not completely. It won't disappear off. The problem with medical therapy is that if you continue it long term, all of these medicines suppress periods, and so therefore you can't get pregnant. Long term medication can have adverse side effects, such as bone thinning. Sometimes the lining of the womb gets thicker because of the absence of periods. So, all of these problems can happen with long term medical therapy. And if you're planning to get pregnant and you can't be on medical therapy because it's counterproductive. There's uterine artery embolization as well, which is one of the ways of dealing with it. And finally, surgery, which is curative, which can be, in the olden days, it used to be done through open surgery, but now more and more we're able to do them either through laparoscopic or robotic assisted laparoscopic surgery, which has a lot of advantages in that you can address big or multiple fibroids because suturing is a lot quicker with robotic surgery because of the 7 degrees of freedom of movement that you have with the instruments that are wristed, which can be more precise. And so, therefore, the total amount of time taken during surgery becomes less. And you know exactly how to suture, and be more precise to help better healing so that there are less complications during pregnancy with uterine rupture.
Okay. And with robotic surgery, because this is a new term, I wanted to know, can I undergo a fibroid surgery and get about moving, get back to work very soon compared to traditional forms of surgery?
Yes, that is one of the major advantages. Quicker recovery, pain is minimal. There's no big incision on the tummy, so there's less risk of hernia, less pain, and a very rapid recovery and going back to normal work and normal activities.